Okay, so more introduction about Raisa. We go a long way. We met, long time ago. Well, not so long in reality, but when she was also a student at UC Davis, and we shared some nice work together. And but then, of course, for a little bit, I've also been a doctor and shared with the experience of clinical trials together. So, but Raisa has been very, in her path, also very successful in the sense that she's navigating through her life. She just got a new job, being a study coordinator, and she's now at UCSF as a study coordinator supervisor. So with that said, we thought about having a little conversation that can close up this meeting and give a lot of hope and to the audience. So Raisa, well, thank you for being here and talking about your story. What have you learned about yourself through your journey with Wilson disease?
Thank you for the lovely introduction. I was diagnosed at 17 by going into acute liver failure. It was a moment that completely upended my life. So one day I'm preparing for college, my senior year of high school, and then the next thing I know, I'm facing the possibility of not having a future at all. So my progression with the disease happened fairly quickly. I started fainting, I was jaundiced, I had hemolytic anemia, which later progressed to gallstone pancreatitis, and then eventually liver failure. Through that, I learned that resilience doesn't mean being fearless or strong in every moment. For me, it has meant learning how to adapt and how to keep moving forward, especially when life doesn't look anything like what you've imagined. And I discovered that I'm stronger when I allow myself to be vulnerable and lean on others, including my clinical care team as well as my family.
Okay, so we all have good moments, bad moments, tough days. What helped you go through the hardest moments?
So two things have carried me through the hardest moments. First one is perspective, and the other one is community. I remind myself quite often that the bad moments don't define my life. They pass and they don't erase the joy or purpose that I've found despite living with Wilson's disease. And then there's the aspect of community. Connecting with the WDA, connecting with other patients and advocates has been really instrumental in my well-being in general. And I found that having people who truly understand what I've gone through makes all the difference. And sometimes a small little check-in text is always nice, or even just a simple "I get it." And yeah, the community and perspective is what gives me the strength to keep going.
So it may be helpful to know for the audience, how do you explain when you decide to your disease, your condition to family, friends, or co-workers, especially when they're not familiar with it, which is most of the time the case.
So I actually keep my explanation, I try to keep it simple. I say it's a rare genetic disorder where my body can't get rid of copper properly. So that copper can build up in my body and damage various organs like my liver or brain. But what really resonates with people when I explain to them what Wilson's is what it means for my daily life. So that means taking medications every day. It means having a copper-conscious diet, watching what I eat. And then it also means that I have to have regular monitoring with specialists and doctors. So, when I explain Wilson's in the context of my daily life, I seem to get a little bit of a a more resonating reaction, I guess. I think this is actually really funny. My dad's a cab driver, city cab driver, and when I first got diagnosed and I was explaining it to him, I was like, imagine the taxi drivers not like the copper content is your, the radical copper is like your, what is it? Crazy passengers in the car, and there's not enough taxi drivers around to, take them where they need to go. So everyone's causing a ruckus, and he seemed to get that. Yeah, so that's kind of how I explain it to my friends and family.
So, can you also speak a little bit about your decision to participate in clinical trial and what was that like, that experience?
Yeah, so I participated in the Alexion trial. It was a very empowering decision, as well as a bit of a hard decision to make. It's scary. The word trial brings a sense of uncertainty, and I wondered at the time, what does this mean for my health? What does it mean for my future? What does it mean for, I was already fairly stable, what does it mean for the stabilization of the medicine if I change medicine? But as a patient, I wanted access to new treatments, and I realized that clinical trials is how we move forward with treating the disease. So what made the biggest difference for me was the clear communication that I got from my care team when enrolling in the clinical trial. I was also, it was also emphasized that my role was not just as a subject, but as a partner in the process. And yeah, it was a very empowering experience. And so if you do get a chance to participate in a clinical trial, I would recommend it. But of course, ask your questions, talk to your family, talk to your doctors, and see if it's the right one for you.
Is there something you wish others understood better about living with Wilson's disease?
Yeah, so living with Wilson's disease, it's amazing how differently the disease presents in different patients. So sometimes it's visible. You can see the neurological manifestations of the disease. At other times, it's invisible. So I think one thing that I would like people to know is that managing Wilson's or managing a chronic illness, it can be invisible, and even on days where I look fine, perfectly healthy, advocating, doing my thing, what they don't see are the fatigue that comes with the illness, the extra steps I need to take for medication compliance, and taking time off, for example, from work to do lab draws and 24-hour urine. So these are the things that aren't necessarily seen right up front. I actually had the privilege of witnessing my younger brother, who was diagnosed at the same time I was. He was 5 years old. So he has grown up with a fairly normal life. He has no symptomatic presentation of the disease, and knock on wood, it continues to stay that way. So it's amazing how much of a normal childhood one can have if treated early with the disease. I was really excited when I heard Dr. Han was able to get newborn screening in Washington, and I'm hoping we can get that over here in California too.
And last question, what kind of support has made the biggest difference?
I'd say connection. When I was first diagnosed, a lot of people did not know what Wilson's disease was, including a lot of the providers that I saw. So finding that connection for me was important. It was a little isolating at first. Once I did get connected through the Wilson's Disease Association, I learned that there's quite a strong community out there. So finding that community, participating in these patient conversations, talking to industry sponsors and clinical trial evaluators has been really empowering, and I feel like it kind of puts a purpose through all this madness.
Well, thank you very much for sharing your story or your personal journey or your details.
Thank you.